Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
By the age of 3, most dogs and cats already have some dental disease, and many owners have no idea. Dog's bad breath? Not normal. Your cat only chews on one side of its mouth? Not normal. Today, we're going to uncover what's really going on inside your pet's mouth and explain why a visit to a dentist could save your pet's life. We'll also answer your other pet-related questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show we encourage our viewers to send in their health questions. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and today we're focusing on any and all dental issues your pet may be experiencing. Our first question comes to us from Parker, who just reached out to our website, allhealthtv.com. Hi, Dr. Carter. I got a Corgi puppy a few weeks back, and I made sure that he got all his shots, but I forgot to ask about dental health. Do dogs and cats really get cavities just like humans? Hi, Parker. Perfect question to kickstart this episode off. So, technically, yes, their dogs and cats could get cavities, but it is not very common at all. Okay. In humans, cavities are very common, particularly because of our diet. A lot of the times we eat things that are very sweet. Okay. Food can get trapped in between our teeth. And then also it has to do with the surfaces, the way our teeth are different than dogs and cats. So humans are definitely predisposed to cavities. Dogs and cats are not, okay? There definitely are some issues that pets can have with their teeth that can kind of be very similar to cavities. But as far as me personally, now I'm not a veterinary dentist, but as me personally seeing a dog or cat with a cavity, I have yet to see it. But definitely dental health is still going to be super important, not just because we're, necessarily trying to prevent cavities like we do in humans, because there's a lot of other things that we're trying to prevent. Our next question is going to be from River, who reached out to us through Facebook. Hi, Dr. C. How often should dogs get their teeth professionally cleaned? And is there a different time frame for big dogs versus smaller dogs and cats? Hi, River. All right, before I answer your question, let me go over the top 5 ways to keep your pet's teeth healthy. So number 1 is going to be brushing daily. All right, that is very important. Just like with us brushing our teeth, we definitely recommend brushing your pet's teeth. Regular professional veterinary cleanings, dental chews and treats are always good. Water additives and rinses, and appropriate chew toys. All right. So let me go back to your question, River. All right. So I will say this, as far as dental or periodontal disease, we do tend to see it more common in the smaller breed dogs. Okay. I feel like that is partially because of kind of some genetic things as far as the shape of their mouth, the size of their jaw. A lot of times you can have these smaller breed dogs that have smaller jaws, but you've got all these teeth that are crammed in there. Some of these smaller breed dogs can get what's called retained deciduous teeth, where the baby teeth don't fall out. And it's more likely for tartar and calculus to get trapped kind of in those teeth. Certainly their diet may be a little bit different. Some of those smaller breed dogs are going to eat more moist or wet food versus maybe hard and dry kibble. And a lot of times the smaller breed dogs are not chewing on a lot of toys or other things like that, like your larger breed dogs are. But certainly large breed dogs can get dental disease. A lot of times we do tend to see it maybe a little bit later on in life when they're older, versus with the smaller breed dogs, we can see it sometimes within the first couple of years of life. And the same thing with cats. Cats can be very hit or miss when it comes to dental disease. You can have some cats that can develop really severe stomatitis, which is inflammation of the mouth and the oral cavity at a very early age. And then you have some cats that develop it later on. The best thing to do, River, is if you have a concern about like your pets, as far as their teeth and whether they need a dental cleaning or anything like that, is just schedule a regular checkup with your vet. And he or she's going to let you know if it is time to see about getting their teeth cleaned and maybe some other things you can do at home to try and kind of help with their dental health. Okay, we got another Facebook question from one of our loyal viewers, and it's from Dante, who reached out through our Facebook page. Hey, Doc, what are your thoughts on non-anesthetic dental procedures on pets? I'm really afraid to put my 6-year-old Bashan under anesthesia for a dental cleaning, but her breath just ain't pretty. Hi, Dante. All right. I feel you. I've definitely met a lot of pets that have had some pretty bad breath. Okay. As far as non-anesthetic dentals go, they do not replace professional anesthetic dental cleanings by your veterinarian. Okay. Um, I have some vets that are very big advocates for non-anesthetic dental cleanings. And I will say, as far as my personal opinion, I believe they are a great maintenance in between anesthetic professional dental cleanings. So say like your pet gets a professional dental cleaning maybe every 3 or 4 years. Those years in between, you can maybe see about doing a non-anesthetic dental. Now, all a non-anesthetic dental is they basically take your pet, and if it's a small dog or a cat, they typically will wrap them up in a towel to kind of make them feel safe and secure, like a little burrito. And they will go in with special instruments, just like they use on you at the dentist's office, and they will hand scale the teeth. Okay. And then they will basically like brush the teeth. Now, the problem is with the non-anesthetic dentals, they can't really get underneath the gum line very well. And so there certainly can be pathology or, issues with the roots, and definitely stuff that's going on under the gums that they're just not able to get to. And then part of it depends on how cooperative your pet is. Okay. Imagine having to hold a little chihuahua in a burrito and then trying to lift up his teeth and scrape off this tartar and calculus. Some pets are very open to it and they will let you do it. And some pets are like, not going to let you do it. So a lot of times it may not be even good quality as far as the scaling that they're able to do, depending on how cooperative your pet is. And then there are just some pets that listen. I've had people come in and say, oh, I'm going to take my pet to get a dental cleaning tomorrow at the groomers. And I look at their teeth and there is just no way that nothing besides an ultrasonic scaler is going to get off all that stuff on their teeth. And there's only so much these non-anesthetic dentals can do. That is why definitely regular professional cleanings are recommended, and your veterinarian is going to let you know when it is time. Doesn't mean that it needs to be every year. Every pet is different, and that's why I believe you need to bring your pet every year to get their teeth checked out, okay? To get everything checked out. And your vet's going to let you know if it's time that he needs an anesthetic dental. If it's not time, you certainly can talk to your vet about doing a non-anesthetic dental. Some veterinarian offices will have a company who will come to their hospital and do the non-anesthetic dentals, or they can give you the information on maybe a place that they recommend, okay? But, non-anesthetic dentals do not replace regular professional under anesthesia dental cleanings, all right? Our next question comes to us from Kennedy, who just visited us on Instagram. Doctor, my 10-year-old Chihuahua's left cheek was swelling under her eye. When I took her to the vet, they told me she needed her teeth cleaned and a few teeth extracted. Just what the heck is going on with my dog? Hi, Kennedy. All right, I want you to sit down and take a deep breath. It's going to be okay. All right. Now, obviously, I haven't seen your pet, so I could not say with 100% certainty what exactly is going on. But to me, it sounds like your Chihuahua has what's called a tooth root abscess, okay? It is very common in dogs, and we can see it in cats. Basically, what a tooth root abscess is what it sounds like. It is an abscess around the root of the tooth. And remember, the roots of your teeth are in basically your sinus area, okay? So part of your sinuses is your cheeks. And so if it gets a bad enough infection, there will be a buildup of discharge, okay, or what we call kind of purulent discharge or pus. And there has to be a way for that pus to sometimes make its way out. Sometimes it can come down through the gum line, or unfortunately, it can start to swell the cheek and it can rupture through the skin. So it is very, very common. Typically, when that happens, your doctor may put your pet on an antibiotic and some pain meds or an anti-inflammatory for a time period. And then they're going to see about getting you scheduled for a dental cleaning. And the majority of that time, that tooth is going to have to be extracted. Even if that tooth looks otherwise healthy, whatever you see below the gum line, if it looks healthy, there's a tooth root abscess, it's got to go. And this actually happened to my own Pomeranian. I thought that she had got stung by a bee because both sides of her face, her cheeks were swelled up. Gave her some Benadryl. It kind of helped a little bit. Gave her some antibiotics. It went down and then boom, it happened again. And luckily the hospital that I was working at had a veterinary dentist there working. And so I took her in and he said, yeah, she's got a tooth root abscess. And they put her under anesthesia. They did her dental cleaning and then they had to remove some of her teeth. And I promise you guys, her teeth were not that bad looking because I'm pretty good about being on top of my dog's dental care. But yeah, it can certainly happen when their teeth don't even look that bad because it's infection that is in the root that you can't see up underneath the gum line. All right, Kennedy. So hopefully everything goes well with your Chihuahua, okay? Just take a deep breath. It's going to be fine. Just you're going to need to get her teeth cleaned and she's probably going to have some teeth extracted. It's not the end of the world. Dogs don't know that they're missing teeth. Only we know, okay? All right. This question comes to us from Harrison, who reached out through YouTube. Hi, Dr. Carter. A few weeks ago, I was walking by the beach when I noticed a police dog that looked like it had a gold tooth. So here's my question. Can dogs really get root canals and crowns on their teeth? Hi, Harrison. Yes, you are correct. While it's not very common for pets to get root canals or get crowns, it definitely, certainly, there are dogs, particularly working dogs, who definitely have to have their teeth for their job. Now, obviously, as a police dog, it depends on what they're doing, but a lot of these dogs are trained to go after criminals. And so one of the ways they catch them is by biting them. So if they have an issue with one of their teeth, in particular the canines, kind of like the fang teeth, what we call it, those are the teeth that are used quite a bit for chewing and for biting. They can't afford to lose that tooth. So if they have a tooth that is diseased or say, for whatever reason, they certainly can get a crown put on. Now, most veterinarians do not know how to do this. Okay. There are board certified veterinary dentists. And actually, we have quite a few in the area. And typically in bigger cities, you're going to see them also. Okay. But those are the places that is going to have those procedures done. And they're not cheap. Now, I don't know if I would say they're as expensive as us going to the dentist and getting it done, but they definitely can cost several $1,000s. So the majority of pet parents, unless they have that money and want to spend it, if a pet needs to have a tooth that is extracted, usually, or, it needs to have something done to it, like a root canal, we'll just extract it because it's going to be a lot cheaper. Like I said, dogs and cats don't know that they're missing a tooth, doesn't bother them. But if they are a working type dog that needs that tooth for their job and they can't lose it, then certainly you can have that done. So pretty cool that you saw that, Harrison. I have certainly seen that with a couple of working dogs at one of the hospitals I used to work at. We used to service some of the police dogs there. All right. We've got another question from our website, allhealthtv.com. And this question is from Aisha, who asks, hi, Dr. Carter, are certain breeds more susceptible to dental issues? Hi, Aisha. I love this question. So kind of answered it a little bit earlier with kind of the big dogs versus small dogs. So yeah, definitely a lot of the smaller breed dogs, okay? Your Chihuahuas, your Pomeranians, your Yorkies, your Bichons, your Malteses, any of those cute little toy breeds that we have out now, they are more predisposed to dental issues. I talked about having retained deciduous teeth. That's basically just like having your baby teeth and not losing him. I see that very common in the Chihuahuas and in the Yorkie breeds. Most of the time, those baby teeth are very easy to remove, but some owners don't even know that they're there until they get their pet examined by a vet and then they see them. But definitely the smaller breed dogs are going to be the ones that tend to have more dental issues. Okay. So any size dog, any breed dog certainly can. But as a veterinarian, I would say your toy breeds are going to be our number one, breed that we're going to see that comes in that's got the stinky mouth and the rotten teeth. All right, we got another question from our Facebook page, and this one's from Pia. Dr. Carter, I took my tabby to the vet because her mouth seemed to be in pain and her gums were really red and swollen. The vet said something about severe stomatitis and that she might need to have all of her teeth extracted. I've never heard of stomatitis. What is it? Hi, Pia. I'm really sorry that your cat is having issues, but yes, stomatitis can be really bad in cats. And in particular, there are certain cats that can kind of almost be like allergic to their own teeth, okay? In the sense of that if they even develop the smallest amount of tartar or calculus, even though it may not seem like anything to us as far as something we should get cleaned off, it can cause a severe inflammatory reaction. I've seen cats come in with literally their gums are just bright red, they're bleeding, they have ulcers, swellings in the back of the mouth, kind of even going down their throat, on their tongue. And definitely those pets are the ones that sometimes, besides getting, their teeth cleaned, they need to have their teeth extracted. A lot of times, though, we don't necessarily have to extract all the teeth. Sometimes we can just extract the teeth that are behind the canine, so the teeth that are here and here. And sometimes that can be enough. I definitely will say this. If your pet needs to have all of its teeth extracted, you want to make sure that you go to somewhere that provides dental x-rays, or you may want to go to a veterinarian dentist. All right. These guys or women or men, I should say, men and women are professionally trained, okay, to be able to do these types of extractions. Because a lot of times these teeth, they're not really diseased looking on the outside, but they're definitely causing a huge inflammatory response. So that means trying to extract a tooth that is not diseased and is not loose can be very hard. And there definitely can be complications from that. You could have roots that break off. You can possibly have even fracture of the jaw, different things like that. So if your pet is going to need that, make sure you take them to a veterinarian who is qualified and knows what they're doing. Because I have unfortunately seen sometimes when, a vet tries to do something good and unfortunately they have a bad outcome. All right. All right. The next question in our queue comes to us from Mateo, who reached out on our Instagram page. Doc Joy, my friend said that we can give our dog just dental treats instead of brushing. I'll be honest, I'm feeling a little skeptical about this. Would love your thoughts. All right, Mateo. So yeah, technically you can give your dog just dental treats, but if you are able to brush your teeth, that is definitely going to help them as far as preventing calculus and tartar buildup as fast. All right. Now, I know there are some dogs out there that are little land sharks and that will try and bite anyone, including their owners, if they put their fingers near their mouth. And so maybe your pet is one of those, or maybe your pet just like absolutely will not tolerate it and will run away and you can't catch them. If that's the case, I'd like for you to brush your dog's teeth, but you don't have to. Okay. Don't freak out. There's a lot of other things you can do. Definitely dental chews, treats, things like that are one way you can try and keep their mouth healthy without necessarily having to brush their teeth. All right. So Mateo, all right. If you can, brush your dog's teeth. If you can't, like I said, you've got other options you can do. All right. Haven just reached out to us through our YouTube page. Hi, Dr. Carter. Our cat Angel was drooly and not really eating much. So I took her to the vet where she stayed overnight. The vet left a message for us and said that Angel has feline resorptive lesion, which sounds terrifying. What the heck is it? Hi, Haven. It does kind of sound scary, but fear not. I'm here to put you at ease. So feline resorptive lesions, I guess, would be kind of what we could consider similar to the cavities, even though it's not really caused by the same thing. So basically, they are where parts of your cat's tooth starts to be absorbed. You have these type of cells, I think they're called odontoclasts, okay, that start to basically break down the tooth. And so they start to develop like holes in their teeth. And that can definitely certainly be very painful because it can start to expose the pulp and the root. When I see this in cats, they're very, very sensitive to the touch. You go to even touch that tooth and they start like just chattering their mouth from the pain. And a lot of times they certainly can have some swelling around the gum line and some redness. They certainly will salivate. They may not want to eat on that side of the mouth, different things like that. If your pet does have feline resorptive lesions, the treatment typically is to have those teeth extracted, okay? And that is going to be the best thing for them. It's going to help them be pain-free. It's going to help make them so much more comfortable. I had a gentleman earlier this week at my practice who was so worried about his dog losing its teeth, but his dog had horrible periodontal disease. And the thing is, people don't understand that, pets in general, they don't care about how they look, okay? If they're missing teeth, they're missing teeth. It doesn't bother them, okay? They just want to have a mouth that is free of pain and that is comfortable. And a lot of pets with severe periodontal disease, including cats with feline resorptive lesions, they have very painful mouths. And so, yeah, while you may not want to have your pet lose a tooth, it is, a lot of times what needs to be done, and they are going to be fine. All right. And I have seen cats who come in with such severe, you know, what we call the resorptive lesions and stomatitis and things like that, that they just were not eating. They were in such pain. I've had to remove their teeth or extract that tooth. And then the next day, they're eating like a champ because they feel so much more comfortable. Okay. So, all right. I'm so sorry that your cat is dealing with this, Haven, but understand that it can be treated, most likely extracting the tooth. Okay. And everything will be fine. All right, let's go to our next question. All right, and this is going to be from Bruno on allhealthtv.com. Hi, Dr. J. How is pet dentistry different than human dentistry? All right, Bruno. So I will say this, as far as in human dentistry, I think there's a lot more procedures and things like that that can be done. I just mentioned earlier in some of the other questions, like a crown, root canal, things like that can be done on dogs. We don't really deal with, I guess you could say, like dentures and things like that so much in pets. And obviously, that is something that's very important in human dentistry. We do have board certified dentists, just like you have, human doctors who are trained in dentistry. So that is one similarity. I would just say, in general, most pets, they don't have to go to an actual veterinary dentist to have, their teeth extracted or to get dental cleanings done or just for a checkup. We have to go to a dentist. We're not going to go to our general practitioner and say, hey, look at my teeth. You can, but he's probably going to say, hey, you need to go to your dentist. So while there is some overlap as far as what they're able to do, with pets and as far as their teeth, there is a lot more things that is done on the human side. Mostly that is for cosmetic reasons because most people want to have their teeth. Our smile is a very important part of our personality. And so if we're missing our teeth and we're missing our smile, that's a big thing. And the dog, they don't really care. They're still cute, even if they have teeth or don't have teeth. But good question, Bruno. All right. This is from Hildy, who reached out to us through YouTube. Hi, Dr. Joy. We have a big old St. Bernard who slobbers all the time and has pretty nasty case of chronic halitosis. But that's pretty common with big dogs, isn't it? All right, Hildy. So in case our other viewers don't know, halitosis is the medical term or the fancy word for bad breath. So yes, you can certainly have some pets that can have bad breath, but they may not necessarily have severe periodontal disease. And sometimes we really just don't know what causes it. But I would say the majority of pets that I see that tend to have really bad breath, okay, are also going to have really bad teeth. Now, if you are concerned about your dog's or cat's bad breath, best thing to do is take them to your veterinarian and get them checked out, okay? They will tell you what is going on if they've got periodontal disease. One thing I will say is that everybody's probably heard of the phrase puppy breath, okay? Definitely puppies kind of have this sweet, but almost kind of like an ant odor to their mouth. That doesn't mean they have periodontal disease. I really don't know why they have that odor. Maybe some other veterinarians do, but I have no clue. But there's definitely something called puppy breath that they can have. And I will say this, it's just like with humans. Some people can have issues with bad breath, but not have bad periodontal disease. But certainly there are things out there that you can use to try and help freshen your pet's breath. They are water additives, there are rinses, and then obviously the chew toys and regular brushing is something that you can do. And remember, not only are your teeth important, but so is your pet's teeth. So definitely brush your dog and cat's teeth. Use those treats, use those water additives, whatever you need to do, okay? Because a happy smile for your pets is also good for them, all right? You guys have a great day. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.